Hey guys, so today I want to talk about postpartum rage. What is it? What are some signs and symptoms? How common is it? And what are things you can do to help it, to help either treat it or prevent it? So let's get into it. So, what exactly is postpartum rage? So, postpartum rage can be after you give birth, you might just feel really angry, really irritable, unlike your normal level of like what you would normally be when you get angry or irritable. Just anger, irritable all the time, mood swings. It might become physical, throwing objects, pounding things, swearing, just, things that are really not yourself. And having even these violent thoughts, tendencies, or urges, and then afterwards just feeling like these flood of emotions and you're unable to control yourself, like physically and mentally. You feel you're unable to control your temper and it just gets out of hand, and it can affect like your thoughts, your emotions, how you act. It can get physical, just all types. Rage takes over basically everything, and you're unable to think clearly, unable to function, as you normally would. You're just so irritable and rageful, and it can just be all of a sudden, or it can develop over time. A lot of times they think that it comes from all the hormonal changes that happens whenever we do give birth. So our hormones do play quite a big role, and after we give birth we have like a big shifting of hormones. That's why a lot of women in general get baby blues, because up to like, I think it's 80% of women do get like baby blues, but women can also get postpartum rage. All these hormones, unbalanced, and just being overwhelmed of a newborn in general, and probably not eating or sleeping right. And then, yeah, it's just a lot on one person's plate. So, and then you add hormones in on top of that. It's kind of a recipe for disaster in a way. So, yeah, a lot of women do get a lot of like postpartum depression, anxiety, rage, even psychosis. There's all types of things that women can get in the postpartum period that aren't really spoken about because a lot of it is stigmatized. So they don't really have like an official diagnosis for postpartum rage, but they say that it's linked closely to postpartum depression, and it also has to do with probably not sleeping right. You're probably getting intervals of sleep and probably not much sleep at all. And then, of course, with our hormones, probably not eating correctly, and just if you don't even have like, if you don't have much support, that all of that together can really put someone into kind of a rage, or put them at risk for having, developing postpartum rage. They say that like they don't know why women get postpartum rage. Getting postpartum rage can be most common in the first 6 weeks, but you're honestly still at risk for up to a year from when you gave birth, just because of all the hormones and all the big shifts in your life. Everything has changed. They say that you're more likely to get it if you do have mental health conditions already, or if you're bipolar. And a lot of it is overlooked. They say about 1 in 4 women are at risk of getting a mental health condition in general, like in the postpartum period. So, which is quite high, and that's quite a lot of women. And they believe that a lot of stuff is underreported just because of the stigma attached to it or lack of access to providers. So, how is postpartum rage treated? It seems that postpartum rage is kind of treated kind of like PPD and PPA, like with postpartum depression and postpartum anxiety, medications, therapy, support, maybe group therapy and individual therapy, but also medications, and also lifestyle changes, as in maybe if you and your partner are able to work on a schedule where you can get more sleep in blocks versus intermittent sleep, which can be worse for you. That might help. Diet, exercise, just social support as well. Maybe not just being cooped up in the house, but being able to get out, and just, but again, that you have to have access to those things in general. Postpartum rage they do believe it does go away on its own. That was the case with me. My rage kind of peaked at maybe the 2 to 3 week mark, and then all of a sudden after like 3 or 4 months it kind of just disappeared. But again, I was on medication because they diagnosed with PPD and PPA for the postpartum depression, postpartum anxiety. I didn't want to tell him about like the rage. And I think like with the medication and then starting therapy after a few months, I think the help of those together, and then also having a very supportive husband, I think all of that together helped, because after 3 to 4 months, I started to feel more like myself. My outbursts kind of started dying down. And I will say, when I was able to, when my baby was sleeping longer stretches at night and I was able to sleep and not have like those intermittent sleep patterns, like I was able to sleep like a good 5-6 hours, that made so much difference in the clarity of my mind and my mental health in general, and my health. Like, sleep is so important, so important. Yeah, it's postpartum rage is scary. It's something that can happen to anybody, honestly. Like, and they associate it being, associated with like postpartum depression, postpartum anxiety. I think it's something they're still doing a lot of research on, but there's no like official diagnosis. And they still treat it with like, how you would treat the other disorders when it comes to postpartum. But honestly, like, I know for myself, when I had it, I would snap. I would say a lot of things out loud, things that like I don't even want to repeat. And like, I was not myself, and I'm not a very rageful person. I don't scream a lot. Yeah, so it was pretty crazy that it just started happening. When I would feel rageful in my head and internally, I would also feel it like in my body. Like I just needed to like punch a wall or like punch a pillow or something. Like I just felt like I had to get like this physical aggression out. Like I just don't even know. Like, it's not like me at all. I just, it came out of nowhere, and like I would have all these emotions bottled up, like, or I would just snap. It was just so hard to explain. And like, I remember just like screaming into pillows or like punching them, and like that's not me at all. So I'm not really like a screamer or like someone who does things like that. So I'm thankful that it went away, but it was just a wild time in my life. And I want you guys to know that, if you do experience these symptoms, you're not alone. And I've talked to other women that have also experienced this, and it's something that I feel like is a little more common than what people let on to, just because it's kind of embarrassing, stigmatized to talk about. And it's hard to admit, that you feel that way because, just mom guilt in general. So just know that you're not alone in your feelings, and it's something that like has to do with our hormones, and that sometimes it's just so hard to control this rage that builds up out of nowhere and you just snap. So, it happens. And the most important part is putting baby down, putting them in a safe spot, calling for help. You can always call 911 if you are having intrusive thoughts about hurting your baby. Always reach out to family for help if you do have that luxury of having a village and family, which I know a lot of days now we don't all have that luxury. So, and if you're alone, you can always still call 911 for help or assistance, and they can guide you to the right resources. So, yeah, just know you're not alone, okay?